sorry. Hey, not knowing, can I come in?
Yes.
Hey, my name's McKenna. I'm gonna be your nurse today. I'd wash my hands, I'd put on gloves. Can I check your wristband, please? First name, last name, date of birth?
Maxis.
Okay, patient matches. Do you have any allergies?
No.
Alright. I would raise the bed. On a pain scale of 1 to 10, with 1 being no pain and 10 being the highest pain, what would you say your pain would be?
1.
Alright. Well, we're going to be doing a head-to-toe assessment today. It may take a little bit, but we're going to get through it. I would raise the bed to assess the patient. I'm going to check your head for any lice. I don't see any bugs. I don't see any lesions. I don't see any lumps. Her hair is normal. It's not brittle. It's a regular hair color. I see that her skin is moist, pink. It's not bluish gray. It's not yellow, jaundice-like. Her skin matches her race. She is dressed appropriate for the weather. And looking at her face, I see that her nose is symmetrical. Her eyebrows are symmetrical. Her eyes are symmetrical. Her mouth is symmetrical. Looking at her ears, I see that she has piercings. On both sides of her ears. I don't see any drainage coming out of her ears. The piercings are not infected. I don't see any redness or any irritation. I don't see anything out of the ordinary on the other ear. Can I look at your eyes for a second? Okay. I see that her sclera is white and her conjunctiva is pink. I don't see any yellowing like jaundice. I see that her pupils are equal. They're both the same size. I see that her eye color is brown, which is a normal eye color. I don't see any crustiness or any drainage coming out of her eyes. No coach. Can I look at your nose for a second, please? I don't see any drainage. I don't see any yellow or green mucus. I don't see any deviated septums. I see that her nose is midline. I don't see any lesions or cuts or wounds on her face. I see that her mouth is midline. Her lips are pink. There's no dryness. Her lips aren't cracked. They're not bleeding. Will you smile for me? Will you frown? I see that her facial muscles work. I'm gonna ask you to open your mouth for a second so I can look at your teeth in your mouth. All right. I see that she has no cavities. I don't see any infection in her teeth. I see that her tongue is pink and normal. There's no thrush. I see that her uvula is midline. I don't see any lesions or any infections in her throat. I see that she has braces. Do you wear dentures? No, she does not wear dentures. I see her breath doesn't smell fruity like she has diabetes. She has no breath odor. It smells normal. She has good hygiene in her mouth. I'm going to check her skin turgor. Can I see her hand? Back of her hand. I will check her clavicle. I will check her forehead. Alright, for skin turgor. Her skin turgor is fine. I see it's normal. I'm going to check some pressure points. I'm going to touch around your body. Is that okay? It's going to be in some places, and we're going to see if you have any pressure ulcers or any bed sores, anything like that. I'm going to feel of your head for any pressure ulcers. I don't feel anything on her head. I'm going to do her shoulders. I'm going to do her sacrum. I'm going to do both backs of the elbows. I'm going to do both backs of the heels. Okay, I'm going to do a whisper test. I'm going to ask you to cover one ear, and I'm going to whisper a sentence in the other, and you repeat it back to me. The dog is pink.
The dog is pink.
The dog is pink.
The dog is pink.
She repeated both sentences back to me. I see that she doesn't have any hearing problems. She doesn't wear any hearing aids. She repeats it back to me just fine. We're going to listen to your neck for a second. Is that okay? All right. I'm going to listen to your trachea with the I'm going to listen to your trachea with the bell. Patient would be at a 45-degree angle. They'd be sitting up. I don't see any jugular vein distension. Her trachea is midline. It's not off center. I don't see any lumps on her neck. Okay, we're going to listen to both sides of your carotid arteries. It's going to be right here on the side. On both sides. I will listen for any whooshing sound. Whooshing sound is normal. Normal. I hear a whooshing sound. She has no carotid roots. No lumps. Can you tell me your first name and last name?
Maxley Songbird.
Can you tell me what time it is?
9:56.
Can you tell me where you are?
The hospital.
Alright. Can you tell me the current president?
Donald Trump.
Okay. We got that out of the way. Mouth and speech. Can you say my dog's name is Dog?
My dog's name is Dog.
Okay, I see that she speaks perfectly, no stutters, no slurred speech. I'm gonna ask you to grip my hands. Will you grip my hands, please? I see that she grips my hands perfectly. Will you shrug your shoulders? Alright, she shrugs her shoulders perfectly. Will you hold your hands out like this, and I'm gonna push against them. She has strength, she pushes against my hands. Will you hold your hands out, please? Will you flex them up and flex them down? I'm going to ask you, will you flex your feet up and will you flex your feet down? Alright, she flexes her feet up and down. I'm going to ask you to do range of motion. Will you hold your two arms out? And will you do this, range of motion? Alright, and will you do your feet? Lift them up, down, range of motion. Her range of motion is good. We're going to assess your eyes. I'm going to shine this light into your eyes. It may be a little bright, but let me know if you're uncomfortable or anything. I'm going to shine it in one eye. The lights would be off before I do this. Alright, her pupils react. They're equal, they react at the same time. We're going to do your cardinal fields. I'm going to ask you to follow this pin light. Alright, I see that her pupils are equal, they're reacting to light, and will you look at the pin light, please? And then when you look at the wall behind me. Alright, her pupils are reacting to light and accommodation. Perla. When she walked to the bathroom, I got her up to walk to the bathroom. Her gait was right. She didn't have any limps. She didn't act like she was hurting. Her gait was perfect like a normal human. We're going to listen to your heart sounds. Is that okay? I'm going to have to listen to it on your clothes, so maybe you'll feel a little cold. I will listen to her aortic valve, her pulmonic valve, her ERB, her tricuspid valve, and her mitral valve. I hear that her S1 and S2 is normal. I don't hear any flutters. I don't hear anything out of the ordinary with her pulses. Can we listen? I'm going to listen to your pulses all around your body. Can you give me your hands, please? Alright, we're going to listen to your radial pulse on both hands bilaterally for 60 seconds. Bilaterally, the other hand, 60 seconds. Her pulse sounds fine. I don't hear any skipping. It'd be about a 2, which is normal. I'm going to listen to your dorsal pedis pulse on both feet for 60 seconds. Both feet for 60 seconds. It's about a 2, which is normal. I don't hear any fluttering. They're both equal. Now we're going to listen to your tibial pulse, which would be in the inside of your foot. 60 seconds. 60 seconds. Be about a 2, which is normal. We're going to check you for some edema. I want to see if your skin pits on a scale of 1+ to 4+. Can I get your arm, please? And I'm going to lift your sleeve up. Alright, I see that her skin doesn't pit. It's about a 1+, which is normal. She has no pitting edema. Can I check your capillary refills in both hands? and both feet. Can I have your nails? Capillary refill, it refills in all 10 fingers. All 10 fingers. All 10 toes. All 10 toes. Capillary refills in all 10 toes. When was your last meal? Alright, when was your last bowel movement? Is that normal for you?
Yes.
Okay. I would lay the patient back so I can access her stomach. We're going to be checking your stomach out for a second, okay? I'm accessing her stomach, and I see that her stomach is round. It's not distended. It's not shrunk in. I don't see any ribs showing. I'm going to listen to your stomach in all 4 quadrants clockwise, okay? And I'm going to listen to it up in your shirt. Quadrant 4 for 1 minute each. Quadrant 3 for 1 minute each. Quadrant 1 for 1 minute each. Quadrant 2 for 1 minute each. And I hear that all bowel sounds are normal. I hear bowel sounds in each. If I didn't hear about bowel sounds, I would need to reassess. I would palpate her abdomen, not hard. Feel that her abdomen is normal. I don't feel any lumps, anything out of the ordinary. I'm going to check your aorta valve for Brutes. Is that okay? Alright. We'll do it with the bell of the stethoscope. I'm going to lift her boob up. Is that okay? Alright. See that she has no Brutes. Everything, no murmurs, no skipping beats. Everything's normal. Now we're going to talk about your urinary tract. Is that okay? I'm going to ask you, have you had any discharge? Any frequency peeing? Any burn when you pee? Alright. I would check for bladder distension. I see that her bladder is not distended. It seems normal. It's not full. I'm going to check your pulse. Okay? So I'm going to have to listen to your heart again, and it'll be up under your clothes. Listen to her left side of the heart for 60 seconds. Her pulse is normal. It'd be anywhere from about 60 to 100, and her pulse is about 72, which is normal. I'm going to listen to her respiratory rate now. I'm going to ask you I'm going to put my hand on your back, and I'm going to ask you to watch the TV and pay me no attention while I listen to your respiratory rate for 60 seconds. Alright. 60 seconds is over. It would be anywhere from 12 to 20 breaths per minute. She has about 16 breaths per minute, which is normal. I'm going to check her blood pressure. Is that okay? It would not be over clothing. I would lift her sleeve up. I would do the two-step method. I would wrap the cuff around her arm and line it up with her brachial artery. Pump it up, two-step method. Listen with my stethoscope. Her systolic would be anywhere from 90 to 119, and her diastolic would be anywhere from 60 to 79. Her blood pressure was normal. It wasn't elevated. It wasn't too low. I'm going to ask you again on a scale of 1 to 10, with 1 being no pain and 10 being a lot of pain. What is your pain level now? All right. You don't seem like you're in pain too much, but we'll get that handled and see if you need anything for that. I would check her IV sites if she has any, for any redness, any coach, any drainage, anything like that. I'd check if she had wound dressings. I'd redress the wound, check wound dressings and see if everything's normal. If she has any catheters, I'd provide catheter care, and I'd check her catheters, and any drains, I would check those. Trying to see if I forgot anything. Her carotid artery on both sides, I would listen to with the bell of the stethoscope. I already did that, but it'd be with the bell. See anything? I feel like I did everything. Stethoscope, checking heart rates, and her stomach would be under clothes and never be closed. I provide the patient privacy while she's doing it. Alright, before I leave, I would ask the patient if she needs anything, PPPs, call lights in place, make sure the bed's lowered, rails up. I would take my gloves off, and I would wash my hands before I leave the room. That's it. Time.